Alright, so penicillin. Initially used penicillin was Penicillin G, which was also known as benzyl penicillin. Now, this penicillin has a lot of limitation. So, first of all, we shall check out the limitations of penicillin G, and then we shall discuss like how to overcome all these problems. Okay, so first of all, we shall check out the limitations of penicillin G. So the first problem was it cannot be consumed orally. So we need to give it by injection. Second problem is it is very short acting. So need to be given several times a day. Third problem is its narrow spectrum. Penicillin G are mainly effective against gram positive bacteria. It has very less activity against gram negative bacteria. This shows its narrow spectrum. Next problem is we know that it is effective against gram positive bacteria, but even those gram positive bacteria that were initially sensitive, they have now become resistant to penicillin G. So development of resistance is the another problem. Next is penicillin G can also cause allergy. In fact, it can also cause anaphylactic shock. So these all are the limitations of penicillin G. Next, we shall try to discuss about how to overcome all these problems. So tackling with the first problem, that is it cannot be consumed orally. Now, what is the reason why it is not effective orally? The reason behind that is penicillin G are acid labile. Acid labile means whenever we are consuming penicillin G orally, it is being destroyed, it is being damaged by the acid, it is being broken by the gastrointestinal acid, hydrochloric acid. Okay, so acid can break it down, and so when it is broken down, it cannot be absorbed. Okay, so this is the problem. Now, what might be the solution for this? Solution to this is we have to develop pure penicillins which are not broken by acid. They can be given orally. Now these penicillin are called as acid resistant penicillins. So because they are resistant to acid, they can be given by oral route. They are also known as oral penicillins, and the examples are penicillin V, also known as phenoxypenicillin, oxacillin, dicloxacillin, cloxacillin, and amoxicillin. So these are the examples of acid resistant penicillin. You can remember these names by the mnemonic vodka. Okay, so these are the first class of penicillin, that is acid resistant penicillin. Now the first problem is being solved by this vodka penicillins, you can say. So now going to the second problem, that is short acting. Second problem with penicillin is they are short acting. Now the reason for short acting of penicillin is they are rapidly secreted. They are rapidly secreted. Okay, and after getting secreted, they will be eliminated out from the urine. So penicillin will act for only 2 to 3 hours. So we need to give penicillin several times a day. Now, what is the solution to this problem? One solution is if we inhibit the tubular secretion. If penicillins are not secreted, then they will remain in the blood for a long time and become long acting. And this problem can be solved, and this can be done by giving another drug, that is probenecid. Probenecid competes with penicillin for tubular secretion. So when both penicillin and probenecid are present, only one out of the two can undergo tubular secretion. Probenecid have higher affinity for the pumps, so obviously probenecid keeps on going out. So penicillin cannot go out, so it stays in the blood and keep on acting for a long period of time. So you can say probenecid increases the duration of action of penicillin by inhibiting their tubular secretion. This is one method by which we can increase the duration of action of penicillin. We have got another method by which we can increase the duration of action of penicillin, and this can be done by making a special preparation which is known as a depot preparation. Depot preparation means these are the preparation where the drug will be deposited somewhere, like if we give penicillin by intramuscular route and it is deposited in the muscles, they will be called as depot preparation. Like an example is benzathine and procaine. So if we attach this benzathine to penicillin G, or if we attach procaine to penicillin G, so these compounds, they will hold the penicillin G in the muscle itself. Now the meaning of this depot preparation is, suppose we give nearly 1000 molecules of benzathine penicillin G by intramuscular route. So penicillin G has come here in the muscle, but it will be deposited in the muscle. See, normally if we give penicillin G alone penicillin G, if we give via the intramuscular route, then almost all the penicillin G will come into the blood, and afterwards they will get eliminated out by 2 to 3 hours. But instead of penicillin G, if we give benzathine penicillin G by intramuscular route, then what will happen? Out of 1000 molecules, only 100 molecules have come into the blood. So these 100 molecules will produce the action for 2 to 3 hours, and after that they will be secreted out and thrown out of the body. So when they go out of the body, then another 100 molecules from the muscle will come into the blood, and they will work for another 2 to 3 hours. Again they will go out. Now 100 more molecules will come into the blood from the muscle. So in this manner the drug keep on coming into the blood and its duration of action will be increased. So this preparation will increase the duration of action of benzathine penicillin G, and this benzathine penicillin G is the longest acting penicillin. Now suppose if we give benzathine penicillin G by intravenous route, then what will happen? Yes, benzathine penicillin G, when it is given via the intravenous route, obviously the drug cannot be stored in the muscle. All the drug will produce the action and thrown out of the body. So that means their action will terminate within 2 to 3 hours. So there is no use in giving these drugs via the intravenous route. Therefore, benzathine penicillin G and procaine penicillin G, they are always given via the intramuscular route, so that they are stored inside the muscle and slowly will release for producing the action. Okay. So this is how by which we can solve the second problem, that is the short acting of penicillin. Now coming to the third problem, okay, that is narrow spectrum. Now first of all, we'll discuss the spectrum of penicillins. Penicillin G is mainly effective against gram-positive bacteria. Gram-positive bacteria mainly includes cocci like Streptococcus and Staphylococcus. It also includes gram-positive bacilli like Bacillus anthracis, which is causative bacteria for anthrax, and even Clostridium, which is causative organism for tetanus and gas gangrene. Now among gram-negative bacteria, it is effective against gram-negative cocci, which is normally Neisseria, both Neisseria meningitis and Neisseria gonorrhea. But the main problem is penicillin G is not effective against gram-negative bacilli. And gram-negative bacilli are the biggest group of bacteria. Large number of bacteria are present in this group of gram-negative bacilli. Like for example, E. coli, Shigella, Salmonella, all the Enterobacteria, Protease, Pseudomonas, Klebsiella, all belongs to gram-negative bacilli. So penicillin G is said to have narrow spectrum because it is not effective against a large number of bacteria. Its main action is against gram-positive bacteria. Now the solution to this is we have developed a newer penicillins which are effective even against gram-negative bacteria, and these newer penicillins are called as the extended spectrum penicillins, or simply they are also known as wide spectrum penicillins. The name only says their spectrum is wide, means they can also inhibit gram-negative bacteria. Now the examples of drugs are ampicillin, amoxicillin, carbamazepine, ticarcillin, meslocillin, azloxilin and piperacillin. And you can remember the names of these drugs by the mnemonic ACT map. Okay. So what these all drugs are doing, they are not only effective against gram positive bacteria, but they are also effective against gram negative bacteria. Now, one of the most dangerous gram negative bacteria is Pseudomonas. So, against Pseudomonas, these drugs carbapenicillin, ticarcillin, meslocillin, azloxilin and piperacillin, these 5 drugs are effective against Pseudomonas also. Ampicillin and amoxicillin are not effective against Pseudomonas. They are only effective against gram positive and gram negative organisms, or basically the cocci. But the rest 5 drugs, that is the CT map drugs, they are effective against Pseudomonas also. So this is how we can solve this problem of narrow spectrum. These are the second class of penicillins. Okay. Now coming to the fourth problem, that is development of resistance. Now to understand this concept, suppose this is a bacteria, gram positive bacteria. So normally whenever we give penicillin G, it will kill the bacteria. Now we keep on giving penicillin G since for many years. Now these bacteria, once they had a meeting, and in the meeting they decided that some persons, they are coming from outside and killing our people, so we will not tolerate this. So what these bacteria did was, they kept these security guards. Now the bacteria has security guards and they are waiting with guns in their hands. Now when we give penicillin G, these bacteria is ready to shoot the penicillin G, and when the penicillin G is shot, it will die. So bacteria will survive. So this leads to development of resistance. That means penicillin G is not able to kill the bacteria, and the name of this security guard is penicillinase. Now penicillinase can also be called as beta lactamase, because penicillin is one of the beta lactam. So penicillinase or beta lactamase are the enzymes that will be produced by the bacteria, which will be breaking the penicillin. So bacteria will become resistant to penicillins. So now we also know that bacteria has security guards. So if we send penicillin G, it will be killed. So what we did is, we give these penicillins a bulletproof jacket. Now the penicillin, this bacterial security guards will be keep on shooting this penicillin G. But because bulletproof jacket, penicillin G will not be killed. Now penicillin G will come to the bacteria and they will kill the bacteria. And the name of this bulletproof jacket is beta lactamase inhibitor. And the drugs are clavulanic acid, sulbactam and tazobactam. See, the name only states they will inhibit beta lactamase of the bacteria. So bacterial enzyme cannot kill the penicillin G. So obviously for their efficacy, they should be given along with the penicillin G, so that they can protect penicillin G alone. See, these beta lactamase inhibitors, they cannot kill the bacteria. Their work is just to protect the penicillin G, and penicillin G will be doing the work. So normally we are giving penicillin in combination with these beta lactamase inhibitors, and the combinations normally used are clavulanic acid along with amoxicillin, sulbactam along with ampicillin and tazobactam along with piperacillin. Okay, so these are the combinations effective against the bacteria which are resistant to amoxicillin alone or ampicillin alone. Okay, so these are the third class of penicillins. Now this is the one method of preventing drug resistance. The second method is, instead of giving a bulletproof jacket, we can call Rajnikant, because no bullet can touch Rajnikant. So Rajnikant, it can go inside the bacteria and it will kill the bacteria. So these penicillin, which are called as Rajnikant penicillin, their actual name is Penicillinase resistant penicillin. The name only says these penicillin are resistant to penicillinase, means even if penicillinase is present, still these agent can kill the bacteria. Now the examples of penicillinase resistant penicillin are cloxacillin, oxacillin, nafcillin, dicloxacillin and methicillin, and we can remember the names from the mnemonic condom. Now, among these, the most resistant penicillin is this one, the methicillin. That means if a bacteria is resistant to methicillin, then it is likely to be resistant against to all the other penicillins, and that bacteria is given a special name, that is methicillin resistant staph aureus, abbreviated as MRSA. Now, special point to remember for this MRSA is the resistance to methicillin occurs mainly because of alteration in penicillin binding protein. Okay, see, normally we know will be a penicillin binding protein present on the surface of the bacteria, and whenever we are giving penicillins, this penicillin will be binding with the penicillin binding protein and inhibiting the bacteria. But what happens, what is the special point regarding MRSA is there is alteration in this penicillin binding protein, means penicillin are not able to bind. So when the penicillin are not able to bind, then no penicillin will be effective. So no penicillin is effective against MRSA. So not only penicillin, even no beta lactam is effective against this MRSA. So regarding MRSA, you need to remember most of the beta lactams are ineffective against MRSA. Now we will discuss later on only beta lactams which are effective against MRSA are the 5th generation cephalosporin, and thus all other beta lactams are ineffective against the MRSA. Okay. So this is the 4th class of penicillin, that is penicillinase resistant penicillin. Now coming to the last problem, that is allergic reactions. Penicillin are the common cause of anaphylactic shock. So we are unable to develop any new penicillin which is not causing allergy. The only thing we can do is we can be careful so that allergy do not become serious. So before giving any penicillin, we should do a skin test, and skin test is done by giving intradermal route, the penicillin G. That means we will inject very small dose of penicillin by intradermal route, and we will observe that site for half an hour, that is for 30 minutes. If there is any reaction in that place, means that person is sensitive to penicillins, so we will not give penicillin. If there is no reaction, we can give penicillins. Now one point which is special to remember is if a person is allergic to one penicillin, the person is allergic to all the penicillin also. This phenomenon is called as cross allergy. Like if a person is allergic to ampicillin, we cannot give piperacillin or ticarcillin or any other penicillin. So due to cross allergy, if a person is allergic to one penicillin, all other penicillins are contraindicated. Now not only penicillins, there is a significant cross allergy between different beta lactam antibiotics also. That means if a person is allergic to penicillins, we cannot give penicillin obviously, but we cannot give any other beta lactams like cephalosporin and carbapenems also. Now the special point to remember over here is monobactams. They do not show cross allergy. Therefore, when a person is allergic to penicillins, we can try monobactams. Monobactams do not show any kind of cross allergy. Okay, so these were the 5 problems of penicillin G and the way by which we can overcome these problems. So with this we have completed our topic of penicillin. So quickly we'll jump over to the cephalosporins.